Hello, our Truth Warriors. I've got some news for you, and this is something that I do see unfolding right the way across Canada and being adopted by the rest of the health authorities in the area. The government of BC have just passed Bill 36, which is the new Health Professionals and Occupations Act, and the restrictions that are now in place are not good, not only for the patients, but not good also for the doctors and nursing staff. I'm going to read through the list of new restrictions, and you tell me what you think they are there for. I think this is just an overreach beyond where it needs to be, and they are either preparing for something or trying to continue something. Number one, all BC practitioners must now follow Ministry of Health guidelines for their patients or risk penalties, including loss of licence to practice. Number two, non-compliance with ministry therapeutic guidelines may result in fines up to $200,000 or $500,000. Corporations and also the incarceration of the individual for up to 6 months. So they could send a doctor or a nurse to jail should they not follow the guidelines of the Ministry of Health. So on number three, any anonymous complaints to the ministry regarding a practitioner can be publicised and the practitioner's licence suspended before investigation. So basically, your reputation will be smeared at the slightest accusation, an anonymous accusation that can't be verified. I think that's disgraceful. Number four, ministry agents may now enter a healthcare practice, seize patient charts, and restrict access to that facility without notice or a court order. That means at any time, the Ministry of Health can go into your doctor's office and take your notes, your private confidential material that you have with your doctor. I wonder what they're thinking of doing with that. Number five, refusal to personally accept all ministry mandated vaccines and therapies may result in de-licensure. So basically, they're going to take the license to practice away from the health official, doctor, consultant, whoever it is, if they do not personally accept all ministry mandated vaccines. And we know what they are, don't we? So the college advisory and the boards of the college advisory will now consist of government appointees only, which means there will be nobody on the boards of any of these college advisory boards unless they are appointed by the government, because basically they don't want anybody to speak out and say the wrong things. Number seven, all self-regulatory healthcare professionals in BC will be supervised and governed solely by the Ministry of Health. They are now the only governing body over the doctors, nurses, and healthcare professionals, which to me is dangerous. Number eight, the Provincial Health Office may illegally adopt regulation codes from foreign countries. Really? Without notice. So anytime, here we go, we're doing this now because that's what they're doing in foreign countries. I think more so that that's going to be a directive from the World Health Organization, but they don't put that into text. So they're going to legally adopt regulation codes from foreign countries without notice, justification, consultation, voting, or oversight. That's just a law unto itself. The new Health Professionals and Occupations Act requires further elucidation of undefined terms used in the Act, such as false or misleading information. Sounds like social media to me again. Looks like the fact checkers are coming in for the health authorities. And this, which may be carried out by the ministry at its own discretion. So they can come in and just basically accuse anybody of giving false or misleading information. They want the doctors and the health professionals tight-lipped and not talking about what's going on. And basically what we're seeing, I think, with a lot of current court cases and legal things going forward, maybe this is the reason why. So what are we to think of this? You know, the whole thing stinks of a cover-up and damage limitation. I just hope that the health professionals out there get together and come together and in solidarity, for once and for all, turn round and say no more. We've put up with your bullshit for the past 3 years. Now you want to really drop the hammer on us and put us at risk and have basically doctors, nurses, healthcare professionals dancing to the tune of these health officers. This isn't fair. This isn't how we should run the country, and it's certainly not how we should run our healthcare for the best for the people. Don't accept being lied to, people, and don't accept other people having overreaching powers that are going to take away the best healthcare that you can possibly have. Let me know what you think. Let me know your comments and views, and if you like what we're talking about here, please share, because I think it's getting beyond a joke now, and I'm sure you do too. Thank you.